Hi, my name is Jennifer Reagan. I am the Continuing Medical Education Coordinator. In October, we are celebrating National Medical Librarians Month. Today, I'm here with Dr. Amaka Ofuani to talk about how the librarians serve our health system. Dr. Ofuani is one of Northeast Georgia Health System's internal medicine residents. Hi, Dr. Ofuani.
Hi there.
How long have you been with the internal medicine resident program?
Well, this is my second year with the program, and it just started in July, so I'm about 3 months in.
Okay, nice. In the past couple of years, tell us how your work, your practice, or your residency has been most impacted by the help of a medical librarian.
Right from the beginning, during orientation, you guys come in and you speak with us. You let us know all the various resources that are available to us. And every day I use something that you guys taught us. One of them being that the UpToDate app is basically embedded in our health record system. So it's very easily accessible. Same thing with Lexicomp for looking at drug information. I'm able to access that very quickly. And so that's been awesome.
Nice. I know one of the things that Shannon does is not only does she do the orientation, but she also will do some one-on-one consultations, especially, coming into orientation. There's a lot of information coming to you at one time, right?
Oh, definitely.
So we all know that everyone uses Google to diagnose their ailments, me included. Do you feel that patient misinformation is a problem?
Definitely a problem. Just the other day, I had a patient come up to me and basically say, "Hey, I heard that the new flu vaccine has COVID mixed in it," and it just makes you want to just no, that's not true. What are you reading from?
Right.
So Google has been something that we've been kind of combating as physicians, but with you guys as the medical librarians, you're able to redirect them to appropriate resources such as Medline and things that have been peer reviewed that will get them the best information that they need.
Right. Yeah, I know they tend to use PubMed a lot. I know that Shannon is real passionate about community education, and so they have done several community events recently with St. John's Baptist Church. We had several physicians go, and they were talking about men's health. And so Shannon is working hard to change that culture of misinformation and helping patients really understand not to just use Google as your resource. Try to look at something a little more than that.
Good old Dr. Google.
In the past few years, we've gained data from our community needs assessment that shows health literacy is low in our community in this area. And how do you think librarians and physicians as a team can help with our health literacy in this community?
Sure. I mean, I think that starts by, letting the patient know that you guys are even available here pretty regularly to help them with any questions that they have. As a physician, I would encourage the patient to maybe bring someone that, they trust, that maybe can be an extra set of ears, and just helping them understand what's going on with their health condition.
I always, when I think about my own family, making sure we have that healthcare advocate that comes with us, that can write down things for us, can help us think of additional questions that we need to do. I will say also, when I think about health literacy and what the medical librarians do, I know some of our databases has patient resource information. Do you use that patient information to give to patients when they get a new diagnosis?
Yeah, so when a patient leaves the hospital, we want to make sure that they're basically going to follow our instructions. And we know that a patient is more likely to adhere to what you're saying if they understand what's going on. So, we give them a little printout that explains their condition, the diagnosis, the treatment, and anything that they can do personally to help themselves.
Because our librarians are passionate about community education and health literacy in this area, we are doing a book club called How to Be a Patient. It's a book written by a nurse, and she really goes through teaching us and the community how to be that patient, how to be an advocate, the tips and tricks that we need to know to make sure that we're receiving the best care that we can. We would like to remind everyone here at NGHS and within the community that when it comes to finding credible health information, you do not have a better partner than a medical librarian.